My name is Rhonda Ullom. I'm a COMT, Certified Ophthalmic Medical Technologist, Fellow of the Contact Lens Society of America, Ophthalmic Scribe Certified, Ophthalmic Coating Specialist, and Ophthalmic Coating Specialist Retina. This is a wonderful field. VEI is a wonderful organization to work for, and I have the opportunity to be their trainer. Our CEO he's always trying to provide world-class eye care for our patients, but also provide a good work environment for us. They wanted to go a step further and look out for us in terms of training our staff, so they hired the Ergonomics Center of North Carolina, and they divided us into 4 main categories: the ophthalmologist, the optometrists, the imaging specialists, and the technicians. One of the first things I'll talk about will be the position at the keyboard. You need to position your keyboard and your monitor in such a way that you're facing the patient as easily as possible. You don't want to have your back to them, and you really don't want to have your side to them where you're constantly having to turn to talk to them. You want to be able to look at them. The other thing that was a big stressor was sharp edges. We were putting a lot of stress on our wrist, so going forward, we'll invest in rounded counters. But currently, we're just going to move the keyboard a little more forward and put a wrist rest there. So that's an example of just a quick fix. Now I want to talk about the slit limb. As a technician, many times I'm going to have to hold the patient's upper lid. If I've got a long reach, then I'm really straining to grab that upper lid. That puts stress on the shoulder. We learned that if we could scoot up closer and not be lunging forward during the exam, that would help. The ophthalmologist, one of the things they're doing is they're looking in the back of the eye with a little handheld lens. When they're doing this, they're holding that lens up there for a longer period of time. That's stressful, reaching up and holding up. If they're going to be for very long at a time, they need to support their elbow. Another exam that the doctor performs frequently, the ophthalmologist and the optometrist, is an indirect ophthalmoscope. And when they're looking in the eye and examining the fundus, they have to look in multiple directions, and they have to look at each eye separately. A lot of doctors, they've got their indirect on, and they're in front of the patient, and they're bending down, and they're contorting around. If they would lay the patient back, there's no strain or stress on the doctor. That's the proper way to do it. Another thing I'd like to talk about now, the refraction. What you need to do is consider not just how tall or short the patient is, but how tall or short you are. You want to be in line with the patient when you're doing their refraction. You don't want them elevated above you where you're stretching. The report showed us that we were putting a lot of strain on our necks and a lot of strain on our backs, especially our lower backs. Now I want to talk about our imaging department. A couple of instruments are really problem children. One of them is our Optos units. The technician has a monitor to the right, and they've got to make sure the patient stays pressed up there because it's awkward to the patient. Then, if that's not bad enough, if they're getting an angiogram, they're also going to have to start an IV. Some of the older units, Optos units, don't have the ability to have an armrest on the unit, and you have to purchase some from outside to hold the patient's arm so that it would be easier and safer to start that IV, and less stress and strain on the imager pushing the IV and taking the ICG images.